The liver is one of the most vital organs in the human body. It processes nutrients, filters toxins, and supports digestion by producing bile. However, when fat begins to accumulate in the liver, it can lead to a condition called fatty liver disease, a silent threat that often goes unnoticed until significant damage has already occurred. Fatty liver disease, medically referred to as hepatic steatosis, can occur due to excessive alcohol consumption, alcoholic fatty liver disease, or unrelated to alcohol, non-alcoholic fatty liver disease. Both conditions can progress to serious complications such as liver fibrosis, cirrhosis, or even liver cancer if left untreated. What makes it particularly dangerous is its subtle onset. The early symptoms are often mild, vague, or entirely absent, making detection challenging without medical testing. Let's uncover the 8 critical signs of fatty liver disease that you need to watch out for, why they matter, and what steps you can take to protect your liver from irreversible damage. 8. Persistent fatigue. Feeling tired occasionally is normal, but persistent fatigue that doesn't improve with rest could be an early warning sign of fatty liver disease. Fatigue occurs because your liver struggles to filter toxins and regulate energy levels when it's overloaded with fat. Fatty liver disrupts metabolic processes, reducing your body's ability to efficiently produce energy. Over time, this leads to unexplained exhaustion, making even everyday tasks feel overwhelming. If you notice long-term fatigue without any obvious cause, it's worth investigating further. 7. Unexplained weight loss or gain. Changes in weight, especially without changes in diet or exercise, may indicate fatty liver disease. Unexplained weight loss occurs because a damaged liver can't process nutrients properly, leading to muscle breakdown and reduced fat metabolism. On the other hand, many individuals with fatty liver disease experience weight gain due to increased fat storage and metabolic disturbances. Non-alcoholic fatty liver disease is closely linked to obesity and insulin resistance, which often result in gradual weight gain over time. Recognizing and addressing these changes can help prevent further liver damage. 6. Abdominal discomfort or fullness. An early sign of fatty liver disease is a dull ache or feeling of fullness in the upper right side of the abdomen, where the liver is located. This discomfort occurs as fat accumulates in the liver, causing it to enlarge and press against surrounding tissues. The discomfort may start as mild and intermittent, but it can worsen as the condition progresses. Ignoring this symptom could mean missing an opportunity to detect fatty liver disease before it leads to more severe complications. 5. Jaundice, yellowing of skin and eyes. Jaundice, or the yellowing of the skin and the whites of the eyes, is a classic sign of liver dysfunction. It occurs when bilirubin, a substance produced by the breakdown of red blood cells, builds up in the bloodstream because the liver is unable to process it effectively. While jaundice is more common in advanced stages of liver disease, its presence should not be ignored. Early detection of liver dysfunction can prevent irreversible damage and guide you toward appropriate treatment. 4. Swelling in legs and abdomen, edema and ascites. Fatty liver disease can cause fluid retention in the legs, edema, and abdomen, ascites. This happens when the liver's ability to produce proteins, like albumin, is impaired. Albumin helps maintain the balance of fluids in your body. Without it, fluid can leak into surrounding tissues, leading to noticeable swelling. Swelling often starts mildly, but becomes more pronounced as liver damage progresses. If you notice unexplained swelling in your legs, ankles, or abdomen, seek medical attention promptly. 3. Dark urine and pale stools. Changes in urine and stool color can be subtle yet important indicators of fatty liver disease. Dark urine, often resembling tea or cola, occurs due to high bilirubin levels in the blood. Pale or clay-colored stools suggest a problem with bile flow, which is commonly associated with liver dysfunction. These changes may not always be obvious, but if you observe consistent abnormalities in your urine or stool, consult your doctor for further evaluation. 2. Increased bruising or bleeding. A healthy liver produces proteins necessary for blood clotting. When the liver is compromised due to fatty deposits, its ability to produce these proteins diminishes, leading to easy bruising or prolonged bleeding, even from minor injuries. This symptom may go unnoticed initially, but can become more apparent as fatty liver disease advances. Keep an eye out for unexplained bruises or nosebleeds that take longer than usual to stop. 1. Mental confusion or difficulty. Concentrating. Known as hepatic encephalopathy, mental confusion or difficulty concentrating can occur when liver function is impaired. A buildup of toxins, like ammonia, in the blood due to reduced liver filtration capacity can affect brain function. Symptoms range from mild forgetfulness and confusion to severe cognitive impairment, depending on the severity of the liver damage. Early detection of this symptom is critical to prevent worsening complications. Why fatty liver disease is often missed. Fatty liver disease is often referred to as a silent condition because many people experience no symptoms in its early stages. Routine health checkups, including liver enzyme tests, ultrasounds, or liver biopsies, are crucial for early detection, especially for individuals with risk factors like obesity, type 2 diabetes, high cholesterol, or excessive alcohol use. How to reduce your risk of fatty liver disease. While fatty liver disease can progress to more serious conditions, the good news is that it's reversible in its early stages with proper lifestyle changes. Here's how you can take proactive steps. Adopt a balanced diet. Focus on a liver-friendly diet rich in whole grains, lean proteins, healthy fats, fruits, and vegetables. Minimize processed foods, added sugars, and trans fats, which contribute to fat accumulation in the liver. Exercise. Regularly. Physical activity helps reduce fat deposits in the liver. Aim for at least 150 minutes of moderate aerobic exercise per week, combined with strength training. Maintain a healthy weight. Losing even 5 to 10% of your body weight can significantly reduce liver fat and inflammation. Limit alcohol consumption. Excessive alcohol use can exacerbate liver damage. If you have fatty liver disease, avoid alcohol entirely. Manage chronic conditions. Control diabetes, high blood pressure, and high cholesterol through medication, diet, and exercise to minimize liver strain. Stay hydrated. Drinking plenty of water supports liver function by aiding in toxin removal and maintaining metabolic efficiency. When to see a doctor. If you recognize any of the signs mentioned or fall into a high-risk category, don't wait for symptoms to worsen. Consult your doctor for a comprehensive evaluation. Blood tests, imaging studies, and even liver biopsies may be used to diagnose fatty liver disease and assess its severity. Early intervention is the key to reversing damage and preventing long-term complications. Conclusion. Take charge of your liver health. Your liver works tirelessly to keep your body functioning optimally. Don't wait until symptoms of fatty liver disease become severe. Proactively monitor your health and make informed lifestyle choices to protect this vital organ. If you found this information helpful, be sure to like, share, and subscribe to spread awareness about liver health. Together, we can help more people recognize and prevent the silent threat of fatty liver disease before it's too late. Your health is worth it.